So the first interaction I had with the food bank was when I worked at the hospital with the clinic, the transition clinic, and we had a lot of people who were making choices between medications and food and medical appointments. And the one thing we thought might be helpful is if we could somehow give them, take some of that choice off their plate. And we reached out to the food bank and they set up some emergency food boxes for us. It had about a week to 10 days worth of food, and we could give those out when the patients came to the clinic. We identified that they were food insecure. And it's hard for someone to be healthy if they're not eating well. And so that was just, it made perfect sense. Let's, provide food. Let's make sure they can get access to it in their neighborhoods. Let's help at the mobile food pantries. We would go out and do blood pressure screenings and blood sugar screenings to help patients manage chronic diseases. And when they're at the mobile food pantries and they've been identified as somebody with high blood pressure or they're a diabetic, having a nurse there to take their blood pressure and talk to them about, yes, it looks like it's in control, or no, you might need to let's make an appointment for you with your physician, or find you a physician. In some cases, we're actually, connecting patients to a health resource that they need. In order for them to have good control of that illness and to not let it progress to create long-term disability is to have good, healthy food choices, fresh fruits, fresh vegetables, whole grains, things that will keep them healthy. A lot of times it's people who are living paycheck to paycheck, and an unforeseen repair came up, car broke down. When it's 110 degrees outside, the electric bill is going to be probably double what you expect, and all of a sudden it's like, oh no, I have to pay a $500 electric bill. How am I going to put groceries on the table too? And so I think during those types of situations, the food pantries become a safety net. So I am extremely grateful and thankful to be able to volunteer at the food bank and get to know all of the employees at the food bank, the office staff, the warehouse staff, all of those of you that are working every day to put together food boxes and mobile pantries and all of the things you do to make sure that the communities who need the food are getting the food they need. Really an awesome thing to be part of. As a board member, I encourage you to continue the good work and just stay focused and stay happy.